Hello, everyone. This is Nurse Felicia once again. I want to welcome you back to my YouTube channel. Yes, it's been a long time, and I'm so excited to be back. Yes, your online teacher is back. So, today, with no further ado, I will be talking about type 2 um, diabetes. What do you know about type 2 diabetes? What comes to your mind when you hear type 2 diabetes? As a nursing student, when you go for your clinical placement and you see a patient with a condition of type 2 diabetes, or you have encountered this patient as a professional. So what comes to your mind hearing type 2 diabetes? Let's dive into it now. So type 2 diabetes is a chronic condition in which the body either becomes resistant to insulin or doesn't produce enough insulin to keep blood sugar levels within the normal range, and as a result build up in the bloodstream. That is the major issue with type 2 diabetes. So that the major issue is the insulin is dysfunctional, is either resistant or is not even producing anything. As a result, is not able to keep the blood sugar level within the normal range. So what are the risk factors of type 2 diabetes? The first one is obesity. So if a patient is obese, or you meet a client that is obese, so the first thing you recognize as a risk factor for type 2 diabetes. Another one is physical inactivity, a sedentary lifestyle. Yeah, can also prone an individual to having type 2 diabetes. Then age can also cause it. Like patients over 45 years or an individual over 45 years, now it's obvious that even younger people are now coming down with this condition, but age has a lot of contribution to this disease condition. And high blood pressure as well, it's also a risk factor for type 2 diabetes. And high cholesterol, that's another thing. An history of gestational diabetes, so if you've been pregnant before, it's a risk factor for coming down with type 2 diabetes at the end of the day. And polycystic ovary syndrome, I'm still going to talk about this thing because it's now very common, especially in young adults, now PCOS. So let's go to signs and symptoms. I want you to, I'm going to give you an acronym today, like a mnemonic that, and which is 3 P's. When you hear about type 2 diabetes, so these 3 things should come onto your mind, and they are signs and symptoms. The first one is polyuria, which is frequent urination. Say one, one. So the second one is polydipsia, which is increased thirst. They tend to consume more water, more fluid. And the third one is polyphagia, which is increased hunger. So let's say it together. The first P is polyuria, the second one is polydipsia, and the third one is polyphagia. So there's increased urination, there's increased thirst, and there's increased hunger. So those are the things. And I want you to also note that part of the signs and symptoms are fatigue, blood vision, slow wound healing. Yeah, when they have wound, it tends to heal slowly. Sometimes they can nurse injury for like 3 months, 6 months, and sometimes it leads to complication that has to do with amputation. Frequent infection. Yeah. So another one is numbness or tingling in the hands and feet, and unexplained weight loss. It is less common, but it is possible. So let's go to diagnosis now. So how do we diagnose type 2 diabetes? I want you to follow me. The first one is fasting blood sugar. So when we are querying this, when there's suspicion of type 2 diabetes, or you are querying type 2 diabetes, then you tend to do the fasting blood sugar. Then there's another one that we do, HB1C. And there's one thing I want to ask you, even as a professional or a nursing student, do you know your HB1C? It's not about age. A lot of things are happening now in this generation, and Even you see a 10-year-old child saying he's having type 2 diabetes or type 1 diabetes. That was in my previous post, video I did type 1 diabetes rather. So you can go back to it and watch that one. So it has to do with age, but now younger people also come down with this. So I want to encourage you, you need to know your titers, know your blood count. So another one is random blood sugar. So it's just encouraging. It's fair enough on your own body to know your random blood sugar. You can just do it even if it's just once in 3 months or once in 6 months. It's very good for you to know your random sugar, your fasting blood sugar, and with this you'll be able to encourage your client and your patient as well. So I just don't want us to forget the fact that part of the diagnosis of type 2 diabetes is fasting blood sugar, HbA1c, and random blood sugar. You can also do oral glucose tolerance test, OGTT, as well. So they are given some amount of glucose, then they do the blood sugar test for some hours, and they compare the three readings together. Let's talk about the treatment of type 2 diabetes. The first one that is very important is lifestyle changes, which is healthy diets. So be conscious of what you put in your body, and as a patient, you encourage them. You want to look into their diet and see what can be cut down, what they can increase. Okay, and another one is regular exercise, weight loss where appropriate. If your patient is obese, then you want to encourage the patient, you want to have a plan to reduce the weight. Then blood sugar monitoring, this is very important. Sometimes blood glucometer rather is being given to them, so they have to be checking it morning, afternoon, night. Some they will tell them you do the reading before you eat, then after you've eaten you also do the reading. I think it's 45 to 1 hour after eating. So you do the test. On some people, they can be put on routine blood sugar test as well. So another one, when it comes to the medications for uh, type 2 diabetes, the first one is metformin, which is also often the first line of management. That is the first line of management for type 2 diabetes. Another one is sulfonylureas, and the third one is GLP-1 receptor agonists and GLT2 inhibitors, and the last one is insulin, and it's being given when needed. So let's talk about the complications of type 2 diabetes. The short-term complication is hyperglycemia. Other one is hypoglycemia, whereby there is a reduction in the glucose in the body, whereby the glucose level in the body is very low. Hyperglycemia is when there is increase in the blood glucose. There is increase in the blood glucose, and the hypoglycemia is there is decrease in the level of glucose in the body. And the long-term complication is heart disease, stroke, kidney disease. There is eye disease, which is diabetic retinopathy. Now, the old former one I was talking about, okay, let's talk about the long-term complication of diabetes, of type 2 diabetes. The first one is heart disease. The second one is stroke. The third one is kidney disease, which is diabetic nephropathy. The next one is eye disease, which can be likened to, can also be called diabetic retinopathy. And the next one is nerve damage, which is diabetic neuropathy, whereby there is damage to the nerve endings in the body, especially the extremities. And that's why sometimes you see the major complication is amputation, because their legs, the toes starts, they step on hot things, they step on needles, they step on snail, they step on glasses, they do not even feel it. And when you are cleaning the wound, they can't even feel anything anyways. You are the one that is have had to take care of a patient that is having this issue with this ulcer in the leg. And myself, I was being careful of scrubbing, of just cleaning. And the man was like, "Oh, you can go ahead, it's fine. I'm not even feeling any pain." So there is damage to the nerve endings, whereby there's reduction in pain and it leads to necrosis. The cells die, the muscle die, and they have to amputate it. There's damage to the blood vessels, though there is no adequate blood circulation, there's no adequate blood supply to those parts of the body, especially the extremities. So it's makes those cells die, and that's why you see, when you see them in the hospital, the legs, the hands, it's smelling like it's dying. Necrosis, sloughs everywhere. And when you do the debridement, sometimes it's heal up, you get to the where there's still blood or circulation, you stop. And sometimes some people, for some cases, it will heal up, and sometimes when they come back to the hospital for wound dressing, you see another slough in that place again. So there's damage to the blood vessels. Okay, so let's talk about and the other one, the last one, is diabetic foot ulcer. I think I've actually explained it before I even got to the point. Diabetic foot ulcer. So let's talk about the prevention of type 2 diabetes. This is very important. I'm a public health nurse, so I major on prevention, health promotion and prevention rather than cure of diseases. So the prevention is maintain a healthy diet. It's very important. So this is an awareness to everyone, to you as a nursing student, to you as a professional, that you should eat healthy. You should have an healthy habit, healthy diet. Make sure that you are conscious. Like I used to tell myself, be conscious of what you put in yourself. That anything you take is just like a medicine to your body. So if you see it in that light, you are being conscious of anything you eat yourself. So the next one is exercise regularly. Don't live a sedentary lifestyle. And I'm telling you, what you do, exercise that your heart is pacing. That is it. You aerobic exercise, not too strenuous, but make sure that you are physically fit. You are doing something to sweat it out. Not that, oh, I've gone to work from morning till night, oh, I've exercised my body. I mean a conscious effort to exercise your body daily. And eat a balanced diet. Is not the portion or the volume of the food. The most important is that it is balanced. We can see protein there. We can see healthy fatty oils there. We can see calories in small quantity, fruit and vegetables. Not, if you are not allergic to it, make sure you eat balanced diet. It can be small but balanced, and it can be in high volume without, it's just calories. So make sure that you eat healthy and balanced diet. Another one is avoid smoking. Yeah, I think in my previous videos, I've had to talk about this smoking cessation. I want you to go out there as a nursing student, as a professional, that this can be possible. Patients can, I'm not saying you should sit, you should be judgmental, but you can encourage them to sit smoking. Rather, you can encourage them to avoid smoking, to stop smoking. Then and patients will also ensure to attend routine checkups. They should book appointment for routine checkup. It's not until they are feeling something in their body that they should go. It can be once in 6 months. In fact, it can be once in a year. Just go for that routine checkup. They should come to the hospital, not when they are shivering, not when they are dying, not when they are sick, but when they are healthy. They can just walk into the hospital. Hospital has to do with disease prevention, promotion, disease prevention. So they can walk into the hospital hale and healthy and just come to do their blood works. So that's very important. So in conclusion today, I don't want to take much of your time. I want this video to be as brief as possible. Type 2 diabetes is common, but with early diagnosis, healthy lifestyle changes, and appropriate treatment, it can be managed effectively. If you found it helpful, please like this video. Please subscribe to my YouTube channel, turn on the notification bell, and watch out for exciting videos and knowledgeable one at that will help you in this nursing journey and as a professional nurse. Thank you, everyone. And we have come to the end of today's video. My name remains Nurse Felicia, and I can't wait to see you the next time. All right. Thank you, everyone. Bye.